Yeah, everyone, Nanami here. In 2022, I was asked to travel across Lutruwita and record our community's stories of quitting smoking. I heard so many great success stories of our people who managed to quit and got a good picture of why our people chose to quit, how they did it, and what supports they were able to access along the way. This is the Makara Patapa podcast.
I'm Di Spotswood. Have quit smoking since early 2090. I worked at the Tasmanian Aboriginal Centre in St John Street since 1986. I'd say 99% of the staff smoked, so at that time we was allowed to smoke in our offices. So it was probably about the early 90s where the centre provided a fantastic opportunity for community and staff who smoked to go to a workshop, which was called... It could have been called No Smokes by a guy called Alan Carr, who was from America and had died of lung cancer. And he developed a program saying there's got to be an easy way to quit. So his program was a guarantee the people who attended his workshop would quit. So it wasn't about hypnosis or anything like that. It was changing our thinking. I started smoking on the Oval at Prospect High back in the late 70s. I'm going, well, she smokes, why can't I? I want to be cool like those girls. We started work 8:45, so we'd smoke 8:45. But of a weekend I wouldn't smoke until 3 or something in the afternoon. So it's just like a habit, I think, with community and staff and stuff. And so much easier because I could just light up in my office. The workshop had 15 of us, and from the 15, one quit, me. And 3 days it took me to get over the grumpiness. There have been times when, if my levels of stress go up, I could have a cigarette, and then I go, Di, your stress levels go up anyway, you're not going to have a smoke. So sometimes I do feel like it's still not that I would ever. And what really gets to me is I'm walking behind someone who smokes. That's horrible. And the other thing I find a bit, but I never say anything, if I'm working with someone who's just had a cigarette, because then I get really bad headaches. But that's my journey. My partner smoked constantly, but he had to smoke outside, and he quit simply because he got really sick with the flu. So he hasn't smoked for probably about 12 years. You know, I put weight on, and one of the doctors said, look, you quit smoking, but you can always lose weight. I was a teenager. I'll quit when they're $1. I'll quit when they're $2. And what are they now, 50 odd? Yeah, so I try to encourage other people. I don't, bully or anyone. I just say that we're here, we're here to support you. Late 80s and 90s at the centre, I'm saying there's 99% of staff smoked. But today, you'd say 4%? Wow. 5%. So it's really good. I think one of the things that was brought into place and I find very powerful is that community can't smoke in this section, outside the centre. Staff can't smoke with community, and staff have to smoke away. And you can really tell at the Generation Cup or any events we have. So the quits where they have to smoke is like miles away from everybody else. The biggest advice I'd say is that their health will improve 100%. Exercising. Instead of having a cigarette, take your dog for a walk and take water with you. And the other big one is pregnant women who smoke, which I don't think is, I'm not sure of the statistics, but it doesn't look like it used to be anymore. But, we're there for them. I always say that we're here. I try not to nag, but we're here for them.
Thanks for listening to the Makara Patapa podcast, a podcast series by the Tasmanian Aboriginal Centre with support from Public Health Services Tasmania.